we have got Coxsackie. Can you see my screen?
Yes, sir.
Okay. So these are the oral infections. Okay, viral infections, bacterial infections, and fungal infections. We have talked about little bit about viral causative agents of oral infections, bacterial and fungal. Today we will talk in detail about a common manifestations which is caused by fungal agent, that is Candida albicans. Okay, so we have talked this topic in other class also. For example, in vaginal thrush, I think that has been taken before as well in your repro. So now these oral disease, these oral candidiasis, which is also known as the oral thrush. You might have seen a newborn child with white patches in their tongue. Okay, that is the oral thrush. Or if an adult that has white patches covering the tongue and oral mucosa, then that can be due to candidal infections. Okay, that is called oral thrush. So the causative agents for these oral infections or oral thrush are Candida albicans, and I think you know most of the things about Candida albicans. They are yeast-like fungus. They are dimorphic fungi. Okay, can exist in yeast and fungal form in same temperature. Okay, they are not thermally dimorphic. In fungus, we have got, when we talk about dimorphic fungi, that means they exist in two different forms. Okay, one is the filamentous form, the other being the yeast form. But there are 6 different dimorphic fungi which are thermal dimorphic. That means the yeast form, they occurs in the body temperature. Okay, and the filamentous form, they occur in the room temperature. So these are the thermal dimorphic fungi. But these Candida albicans, they are not thermally dimorphic, but they are nutritional dimorphic. Okay, so they can occur as a yeast-like form, or they can give pseudo-hyphae or hyphal branch form. Okay, so they are nutritionally dimorphic. Genus Candida, species is albicans, and they shape are they are oval shaped, and size is around 10 to 12 micrometer in diameter. They are gram positive. If you do the gram staining of Candida albicans, then Candida species, then they are gram positive, and they reproduce by budding. Okay, the optimal temperature that required is the 37 degrees centigrade, and oxygen, they are facultatively anaerobes. So we have got many species of Candida, that is Candida albicans, Candida tropicalis, Candida parapsilosis, Candida kiefer, Candida krusei, Candida galbata. Okay, there are other different species also. So all those candidal species which are germ tube positive, they are called Candida albicans. Okay, so all those species which are not germ tube positive or which are not Candida albicans, they are all called as Candida species other than Candida albicans. Okay, if you do not want to write Candida tropicalis, instead you can write Candida species other than Candida albicans. Okay, so that is a generalized term for all these species. So when we take your practical exams, we may ask you about what are the species of Candida. So you need to remember at least 4 or 5 species of Candida. And this is a yeast form, and this is a filamentous form. Okay, pseudohyphal. So there will be budding yeast cells with pseudohyphae in your gram staining smear. So they are normal common cells. That means they can be found normally in our body as well, but they become pathogenic. So whenever there is alterations in the balance of normal microbial flora, just as in the vaginal thrush, right? So what happens whenever there is alterations in the balance of normal flora, or whenever the vaginal flora is replaced, or whenever the oral flora is replaced, then these pathogens will have chance to overgrow themselves. Okay, and whenever there is lowering of host resistance to infections, then they can lead to these candidal infections. So when you see a young adult with oral thrush, then you have to think that what is the reason behind the oral thrush that he has developed. Okay, it does not usually cause an apparently healthy immunocompetent adult will not have oral thrush. Okay, so तपाईहरुले dental procedure गर्दाखेरि चाहिँ if you appreciate there is significant amount of white patches all over the tongue as well as in the mucosa, then you might need to consider that the person might have immunocompromised status. Okay, and one of the most common cause of immunocompromisation is the HIV. So you have to rule out HIV infections as well. So if the patient has developed AIDS, then that patient can have oral manifestations. Okay, predisposing factors for all fungal infections is the same. That is natural receptive stage, infancy, old age, pregnancy, and changes in the local bacterial flora, like by use of antibiotics, changes in epithelial surface, moisture or trauma. If there is T lymphocytes disease, primary or secondarily acquired, then for example AIDS, then they can also lead to the fungal infections. Neutropenia patients, cancer chemotherapy patients, endocrine disease, diabetes, and zinc or iron deficiency, they all can lead to oral thrush or any fungal infections. Okay, so pathogenesis is the host recognition is done by adhesions and invasions, and there is enzymes like hydrolinase, phospholipase, lipase, proteinase. So these all are the enzymes that helps in the fungal pathogenesis or the candidal virulence. Morphogenesis, they can change their form from yeast to filamentous hyphae or pseudohyphae, which also contribute to the virulence factors. And there is a phenotypic switching. Okay, they can switch from into different forms. This is same as yeast form to filamentous form. So these all contribute to the virulence factors of Candida species. Clinical manifestations of Candida, they can be mucocutaneous involvement like oral thrush, glossitis, stomatitis, esophagitis, gastritis, vulvovaginitis, balanitis, chronic mucocutaneous candidiasis, and ocular candidiasis. Among these oral thrush and vulvovaginal candidiasis are the common manifestations of this disease, which can occur secondary to any other primary disease. For example, HIV, AIDS. Okay. बुझिरहनु भएको छ? Are you getting me or lost? Pima Lama, are you there? Okay, so now talking about oral candidiasis or oral thrush, there is a dry white flake within the gum, palate, tongue, and buccal mucosa, and most commonly seen in immunocompromised individuals. For example, HIV infections, or antibiotic treatment patients, or diabetics patients, or infants. In infants also you can see commonly. Okay, and feeling of thrush metallic taste will be there as a clinical features. Oral candidal infections are common and have been reviewed extensively recently. Okay, and the term thrush is applied to a specific form of oral candidiasis that is characterized by creamy white cord-like passage on the tongue. Okay, you will see the picture. So if there is a white patches in the tongue, which are creamy white, then that is considered as oral thrush. And the patches are usually pseudomembranous, containing candida, desquamated epithelial cells, leukocytes, bacteria, keratin, necrotic tissue, and food debris. So I think here you can see these patches, okay, more clearly here. So these patches, they usually contains bacteria that is present as a oral flora, and the yeast, Candida albicans. There is keratinized tissue, and there is neutrophils and all those things. So they all contribute to as a this is another example of oral thrush. Okay. So candidal infections of the hard and soft palate, buccal mucosa, tongues, pharynx, hypopharynx are also observed frequently. If there is oral thrush, then it will involve all tongue, mucosa, pharynx, and hard and soft palate. All these area can be involved in oral thrush. The most common form is the thrush, and that is pseudomembrane formations and characteristics cottage cheese flake that can be removed with a tongue blade and are seen on the soft palate, tonsils, and the buccal mucosa. जो normal देखा थे, त्यस्तो किसिमको white patches, pseudomembranous patches will be there. This is the oral thrush. Here you can see all the white patches. Okay, यस्तो नै manifestations भएर आएको हुन्छ oral thrush मा. Here you can see a child with a white patch covering the oral mucosa, including the tongue, and there might be in the soft and hard palate as well. Okay. Thrush develop in the patients who used inhaled steroids are also on your thrush ko cha arko one of the most common thrush ko patient, oral thrush ko patients haru चाहिँ those patients who have COPDs, okay, chronic pulmonary obstructive disease haruमा चाहिँ के हुन्छ भन्देखि they usually take steroid inhaler, okay, and when they take steroid inhaler they do not rinse their mouth after using the steroid. So what happens if they do not rinse their mouth? Then that can lead to oral thrush. Okay, this is also one of the common conditions. Other is the AIDS, and if an adult has oral thrush, then you have to verify that the person does not have HIV infections. Okay, so HIV infections happen. One of the common manifestations is the oral thrush. Okay, now coming to the diagnosis. Diagnosis can be made by clinical appearance of the lesions and by scraping using either potassium hydroxide smear, calculfluor white, gram stains to show the hyphae and pseudohyphae and yeast form. Okay, sample culturing does not solidify the diagnosis because candida grows easily from the normal mouth. Okay, culture गरेर चाहिँ त्यति धेरै significant हुँदैन, तर if you do gram staining and potassium hydroxide smear, then what happens? You can see gram positive boarding yeast cells with pseudohyphae in the lesions. To lesion मा नै मजाले चाहिँ yeast cells with pseudohyphae देख्नुभयो भनेदेखि then you can establish the diagnosis. But most of the time diagnosis is the clinically नै diagnose भइहाल्छ. तपाईले you see it and you identify that this is oral thrush. Okay, you don't need a laboratory confirmations for diagnosing oral thrush. Other oral lesions are oral squamous cell papillomas haru, हैन, human papilloma virus related lesions हरुले गर्दा हुने भयो. So that's all for today's class. Okay, sir? Anything that you want to ask me? I think most of the thing in this class has been covered before also, because candida को चाहिँ तपाईहरुले अरु बेला पढ्दाखेरि पनि लाइक इन रिप्रोहरुमा पनि you have the same thing. Okay, just the site is different. Otherwise, the pathogenesis, virulence factor, laboratory diagnosis, they are all same for